Hey Live Active community, it's Dr. Asif Ahmed here with Live Active Primary Care. This is the last video of the 7-part series. This is pretty exciting. This is part 7 of 7, and it's called Change the Dialogue, Change the Outcome. We're going to talk about why that's important, what that all means, and then we're going to talk about the 3 techniques to improve communication that ultimately will change health outcomes. So pretty cool stuff. Let's get started. So when we talk about changing the dialogue, change the outcome, what we're saying is this is real talk. Primary care predominantly is about talking and listening. And one of the things that I'll repeat over and over again in this video is that diagnosing, making the diagnosis, and understanding and making the correct treatment plan is only half the battle. That is not everything when it comes to primary care. And that's why a lot of talking and listening is more important in primary care. I think that's a majority of what is really needed for good primary care delivery to improve outcomes. So you could diagnose somebody and make the right treatment plan, but if the patient doesn't follow through and take the treatment or participate in the treatment plan, then everything that you've done and communicated is nullified. It's not even effective. So focusing on getting the diagnosis and treatment, there's more to the story, and that's what primary care is about. So it's real talk. And this is how we get into the preventative side of things, is to talk with the patients, to learn their story, to hear them out. And as we're listening to their story and we're building this relationship, it's a pretty cool and amazing thing that happens. It's almost a magical experience, and I truly mean that. And that's what makes primary care so exciting, is you start to learn about one another, and then questions that the patient may not even realize that they should ask start to get answered by the physician or the healthcare provider as you're talking and listening to their story. And then you also start to figure out what actually will help this patient follow through with a treatment plan. So it truly is a magical experience that happens. You understand the context, you understand their story becomes the context, and so you have this contextual understanding of what is going on with that patient. And then it's finally going to promote compliance, right? So once you understand that your patient fully through listening to their story, then you can create that personalized healthcare plan that we talked about to improve compliance and health outcomes. So let's start talking about the 3 techniques to improve our communication so that we can improve health outcomes, not only in our patients, but also the greater community at large. All right, so step 1 is to individualize the conversation. What we mean by that is focus on that story, listen to your patient, understand the context, understand the experiences that shape your patient's story. And so our job as physicians and healthcare providers is to demonstrate to the patients that we value this relationship and that we're going to work just as hard at building this relationship with you. And it all starts with just listening to your story. And what's important is the healthcare system has to allow the time that it takes to listen to someone's story. It can't happen in 5 minutes or in 10 minutes. And so in order for that interaction to build credibility and trust and all those important components that need to be established when a patient visits with their physician or their healthcare provider, those are just valuable minutes that cannot be rushed. That's a magical moment that cannot be rushed. So individualizing the conversation, focusing on that patient is step number 1. Step number 2 is to personalize the risk. In medicine, we have a lot of algorithms, we have a lot of standard of care, there's a lot of studies that we've done. We know our stuff. There's new technology, new medications, but that does not mean that every patient is going to fill into that category or into that research study completely. So that's why the medicine is an art. And so we have to figure out not only the patient's story, understand their context, understand their culture, etc., but we also have to figure out what is their definition of quality of life, which means what's their goals of care. What do they define as a quality of life? all of us have a start time and a stop time in this life. And so we're all united in a sense that we will all taste death at some point. So quality of life becomes more important than quantity. Living on a ventilator forever, which we can do in these long-term ventilator facilities, that could happen. But if somebody says, my quality of life is spending time with my grandkids, playing with my grandkids, or fishing, well, that means that they're being functional, they're not bedridden, those kinds of things. And so when you start to learn and ask your patient about, what's a good quality of life for you, what do you definitely don't want to experience in your life, that just starts to dictate what kind of treatment plan you're going to do. You're not going to embark on a treatment where it's going to make them very debilitated, very weak. It's going to cause them to require blood work to be done every week or something like that. Will they want dialysis, a big line that goes into the neck or arm, or where they're going to dialysis 3 times a week? For some people, that's not worth it. That's not the type of life that I want to live. And that's fair. That's reasonable. But we need time to listen to people's story and help them understand what these treatments mean and how that will affect their quality of life. So this is huge, is to personalize the risk. When we talk about heart disease and diabetes, yes, there's a lot of risk factors. There's a lot of studies, a lot of tools in our tool belt, a lot of calculations and formulas we can use, but we have to use that and create a personalized kind of approach to patient care. Finally, we have to humanize the health benefits, right? So, we always talk about outcomes. We talk about A1C goals, less than 7%, less than 7.5%. We talk about heart disease. There's calcium scores. There's so many scores and lab values and goals that we have in healthcare, but they have to make sense. And I think the guidelines are starting to move towards this, where we're starting to allow physicians and motivate physicians to personalize goals to the patient. So if somebody is quite elderly, 85, 90 years old, their A1C goal all of a sudden isn't 7%. It might be 8% or 7.5%. We start to relax. Even blood pressure goals. Usually we try to get less than 130/80, but as we get older, the blood pressure goals start to relax a bit because the risk of low blood pressure and passing out and falling and breaking a hip or hitting your head and causing a head bleed, those risks are higher than the benefits. And so you have to start to have a conversation with your patients about risks, and then talking about, well, what are the realistic goals and what are the safe goals? Again, heading towards quality of life, what's going to help you live your optimal and best quality of life. And so in order to achieve those goals, we have to make them tangible, we have to make them realistic. So our overall goal could be to live a good quality of life where I could play with my grandkids and I can run around and still play with them. I want to be active. Okay, well, how are we going to get there? Well, we have to make sure our BMI, our waist circumference, our nutrition, our exercise regimen, meditation, all these things, the foods that we eat. And then, of course, medications have their role in terms of heart failure, heart disease, post-stroke, chronic kidney disease, all these chronic illnesses that we've talked about in previous videos. We have to start to weigh the risks and benefits of the medications and what that all means. So, again, hopefully you've listened to all the previous 6 videos and you can understand how complex primary care is, and how 5-minute visits it just doesn't suffice for the complexity of care primary care delivers. I think we've oversimplified what primary care is. It's not a triage center. It's not this place where you get consults for every specialist or every specialty for every organ in your body. That's not primary care. So we really need to get back to the basics and change the dialogue we're having with our patients in order to improve health outcomes. And again, it's not just the patient's health we're talking about. We're talking about communities. We're talking about our country. We're talking about global population health. As mankind, we're all united in birth and death. And majority of us all want the same quality of life for the most part. We all want to just live life to the fullest. And so we have to focus that, and we have to bring that back into our healthcare system. All right, guys, so that is the last video of the 7-part series. So I hope you enjoyed it. This is the 7 ways to improve health outcomes. I've tried to talk about so many topics that hopefully is useful to everybody out there when it comes to taking care of yourself or your loved ones. Hopefully I intrigued some new practices for physicians, and maybe I've stimulated some politicians to talk about the healthcare system in a different way or to look at it in a different way. I think this is very doable, but I think primary care is at the root of our healthcare system and should be a place where we cannot have prior authorizations and insurance and volume-based incentives. It really has to become a true relationship between patients and physicians, and we have to promote independent private practices. We need to reward that, and we also need to make sure that there are as less of an influence of other factors around the patient-physician relationship when it comes to insurance, governmental regulations, all these things that impact that patient-physician relationship. We have to eliminate that so that the patient-physician can spend as much time as they need to communicate, get to know one another, and to live a healthy life. That's the end goal, is to have a good quality of life. So we need to simplify it. Healthcare is not that complicated. It's actually quite simple. I think we've made it complicated. So let's simplify it together. Get out there, live active, take an active role in your relationships, active role in your finances, be active in your healthcare. God bless. Take care, and I'll see you at the next video.